I just know that one of the things that you have to learn if you have a loved one with Alzheimer's is that they may be telling the same story over and over again, and you just embrace the story and comment that it's fascinating and wonderful instead of saying, "No, you already told that story. You just told me that story." Don't even bother to do that because that only will frustrate them. So just go along with it and just embrace whatever they say and just enjoy the moment.
Yeah, you can make it a lovely experience. If they're telling a story about the time that they went to Niagara Falls, you can say, "What was your hotel like? What did you think about the sound of the water?" You know, you can kind of just ask them questions about that experience versus thinking, "I've heard this before, I've heard this before," you know. And, you know, nodding and smiling is not the same as engaging in conversation. So I think that it's really a helpful class that would benefit really every conversation, but especially
Right.
someone with dementia.
Okay.
So,
Good point. So how has this pandemic affected the progress of your work?
so COVID-19 has really, you know, laid out things for all of us that we never anticipated. And in Alzheimer's Association, we've been handling things on various fronts. First and foremost, we moved our whole staff remote on March 12th, and we anticipate going back full time to our offices when there's a vaccine. So we take a very risk averse approach because we deal with the most vulnerable people, people who are elderly, have comorbidities, or go home to those folks that they're taking care of that could be at greater risk. So we take that responsibility very seriously, not to put anyone we serve at risk. And so we did that. We moved all of our programs and education virtual, and we did not have one program that had to be canceled or postponed in Orange County. We were able to move seamlessly to online platforms and have people have what they needed, and obviously ramped up our one-on-one phone conversations to make sure that people were okay and had what they needed. We moved our fundraising events to either a year away or to a virtual or at home experience. So I'll talk a little bit more about that in a little bit. But we also looked at our research community. We fund hundreds of millions of dollars in research around the world, and if researchers can't be in their lab, what does that mean for them, and what does it mean for their next application, and how can we be supportive of the research community? So not only with AAIC being virtual and exposing tens of thousands of more people to the exciting progress and work and generating ideas, we've contacted each of our 500 grantees that have research awards from us, found out what they needed, how we can help them, and we also have something called GAIN. It's the Global Alzheimer's Association Information Network, and it's a database of statistics that researchers can go to for free and not have to do all that pre-work. They can go in, look at samples, look at analysis, and take a leap to what they want to study in their lab based on all the data that's already been collected. So the silver lining in that is that researchers have time to mine this data. They have time to write papers and articles that they maybe did not have time for before. And they have opportunities to have conversations and collaborations with connections that they make at events like AAIC to really generate ideas. So, the collaboration and conversation and information gathering has been a silver lining of this, but we did have to stop some in-person trials that have to start up again. So that delays the timeline of getting the answers that we want. And, from a senior living and assisted living standpoint, COVID-19, these places were not prepared, and the government wasn't really prepared to help them. And so the Alzheimer's Association really stepped in, working with our elected officials at the state and federal level, and said these protocols need to be put into place. And so on our website, we have COVID-19 recommendations for local and state governments. We've advocated for policy issues, as I mentioned, and we also have resources for folks who if they have someone in assisted living and they're having challenges, we have resources for them either through our helpline or on our website. But we also have resources for people who realize, being at home with someone over this period of time, that they need more care than they can handle, and how to effectively move someone into assisted living is something that we also offer resources for. But really knowing that the disparities that have been talked about as it relates to COVID-19 in the Black community and the Latinx community, and poor populations and older Americans being impacted so much greater by this disease, it amplifies the disparities that we already saw in Alzheimer's. It affects Blacks twice as often, Latinx 1.5 times as often. Obviously, unless it's early onset Alzheimer's, people are elderly or older, aging, and it affects people who come from all walks of life, but a higher percentage are lower income and have more challenges in that regard. So these disparities mirror each other, and just seeing how difficult it is to respond and help at the level of the pandemic. We already knew that about Alzheimer's. And so what we are working on at the Alzheimer's Association is really a public health approach to make sure that everybody who needs care and support and accurate diagnosis is able to receive it. So we're really passionate about that. And I think with COVID-19, it's just heightened this passion because we've seen such an immediate and visible impact, because it's all everyone talks about.
Yeah, it is heartbreaking, and I'm glad that the Alzheimer's Association stepped up like it has.
Yeah.
So, any promise for a cure or prevention in the near future?
So we are always on that drive to make sure that we get there as quickly as possible. I think that these lifestyle interventions will definitely adjust a trajectory that isn't a good one right now, to hopefully flatten that trajectory so that not as many people are impacted through a healthy lifestyle and better social interaction and all of those things that we know are important. We are just doing the studies to prove their importance so we can get the message out there, and people will take it very, very seriously. Because it is very important to take care of ourselves throughout our whole life, and be sure that we can do everything in our power to help prevent cognitive decline. And so the hope on the horizon is really the number of things that are in clinical trials right now, and it's more than we've ever seen in the history of the Alzheimer's Association. We were founded in 1980, and that's not very long. 40 years to be where we are today, with understanding the pathology of the disease, already having a drug that's in FDA approval that can clear out that pathology and show that there is cognitive improvement, is huge in that short amount of time. With the funding that we've had, it's been extremely small compared to other diseases such as cancer and heart disease and HIV/AIDS. HIV/AIDS is a great example of the infusion of billions of dollars to get to a treatment to make AIDS no longer a death sentence. Had a huge impact in that timeline. And so the Alzheimer's Association has been working really hard the last 5 years to increase NIH funding for Alzheimer's disease. And we've been able to quadruple it over the last 5 years to $2.8 billion. But it is still paling in comparison to the $6.8 billion that, heart, cancer, AIDS, they all get above that for research. And so we have catching up to do, but we're hopeful that every additional dollar gets us closer to the cure or the ways to prevent and reverse the disease. So, we're looking at vaccines, we're looking at, obviously lifestyle, we're looking at drugs to halt the disease, all different types of medicine. We're doing some venture philanthropy through our Part the Cloud initiative, and all of these things that we can do to accelerate the timeline give me a lot of hope.
Oh, that's wonderful. I'm hopeful too. Now you've got your special promotional Walk to End Alzheimer's shirt on. And so can you tell us a little bit about it and how it's going to be different this year?
Yes, obviously walks will be different this year, and we're excited because it really gives us an opportunity for people to walk everywhere. This year, the Walk to End Alzheimer's is everywhere in your local community, and I think it's a gift in a lot of ways. You know, usually our Walk to End Alzheimer's, we come together as a big group and do our Promise Garden ceremony and all walk, and people feel connected and supported, and it's a beautiful, beautiful event, and we have great support from the community, from our participants and our sponsors. And we do again this year, and we're creating that same environment for people in their local communities. So you can have a neighborhood walk, you can hike a trail, you can, you know, go on vacation and walk on the beach, you know, whatever you want to do. But we're keeping all of our local walk dates. So our Irvine Walk to End Alzheimer's is still September 26th. Huntington Beach is October 3rd. And San Clemente is on October 11th. And what's going to happen each of those days is we have an actual app for your phone for the walk, and you're going to log into that app on the morning of walk, and you're going to see the opening ceremony. You're going to have a chance to participate as an individual or a group with your family, or virtually as colleagues. You know, in a business setting, we have a lot of great company teams that support us, so great way to engage in that and have, you know, being social. But going through that meaningful opening ceremony is such an important component of our walk. So we're saying we're walking everywhere. Walk isn't going to be virtual. You're not going to be sitting on a computer, you know, watching the walk. You're going to be out walking, and the app is going to track your steps, and it's going to cheer you on, and it's going to share our sponsor booths and have an interactive experience just like you would on walk day. So that part's really exciting. And then in each community where we hold walk, we're having a promise garden, drive-by promise garden that people can come and view, so that they have that same meaningful, moving tribute to their loved one. The flower that represents their connection to Alzheimer's disease will be planted in a special location to be announced to everybody who signs up, so they'll have the opportunity to go visit that. So that's really great. And then they're getting their own kit in the mail with flags and a yard sign, and if they raise $100, they'll get a t-shirt, so they can really create their own walk experience right in their own neighborhood. And I'm really grateful that we've done this to make the experience accessible to people who maybe haven't been able to come out to our walks before because their loved one may be not wanting to leave the house, or doesn't feel comfortable getting in the car, or it's too difficult for the caregiver to get the loved one in the car. You know, they can walk around their backyard and, you know, push that wheelchair if they want, and just have a beautiful day together. So we are really excited, and all the information about the walk is on our website at alz.org/walk. So it's very easy, or you can just Google Walk to End Alzheimer's and you will get all the lovely information. But we have such an exciting feeling about this year that, you know, when things return to where we can all gather again, hopefully we'll keep some of the components so we can include everyone moving forward.
Great. Well, hopefully you'll have as large of an attendance as you had for the international conference.
Wouldn't that be amazing?
Yeah, yeah. It seems that the virtual does help in some instances to get more people.
Sorry.
Oh, no worries. Now, as we're wrapping this up, are there any sayings or quotes for inspiration that you'd like to share with us?
So I think my most inspirational quote is really our vision at the Alzheimer's Association, which is a world without Alzheimer's, because it motivates me every day, because I have my own personal journey with my family with this disease, and I see each day how much people need us and how important it is for us to get the job done.
Wonderful. Well, thank you so much, Anne. I really appreciate you taking the time and sharing with us all this very important information. Have a wonderful day.
Thank you. It's nice being with you.
Thank you.
Thanks.